I'm going to do some NCLEX questions with you on GU to help you prepare for your next exam. So I'm going to read the question to you, I'm going to read your options, and I'm going to give you a few seconds, minutes, maybe, probably seconds, to go ahead and answer the questions. I want you guys to use the ABCD method that I've talked about before. So real quickly, I'm going to demonstrate for you. Please don't judge my handwriting. This is very difficult, but here's your A, here's your B, your C, and your D. And when I go through, you guys are either going to put a question mark, meaning you're not sure, okay? Oh my goodness, so sorry guys. Not sure. X means it's not correct. And check mark means it is correct, okay? Meaning you have a rationale. Now remember, if you have any question marks or check marks, then you must put a rationale. So let's do number 1. So a patient returns to the clinic with recurrent dysuria after being treated with trimethoprim and sulfamethoxazole, which is Bactrim, for 3 days. Which action will the nurse plan to take? Is it A, remind the patient about the need to drink 1,000 milliliters of fluids daily? Is it B, obtain a midstream urine specimen for culture and sensitivity testing? Is it C, teach the patient to take the prescribed Bactrim for at least 3 more days? Or is it D, suggest that the patient use acetaminophen to treat the symptoms? So I want you guys to go through and do as I said. Do your A, B, C, and D. Now, if you think A is correct and you're like, I have a rationale for this, then you put a big, oops, I'm so sorry. You put a check mark, okay? Just like this, okay? If you think B is definitely not correct, you're gonna put a big old X. And let's say you're like, I know I said A is correct, but C could potentially be correct, and maybe D could be correct. You're just not sure. Put those question marks, okay? So once you've gone through and done your A, B, and C, and D, I want you to look at your paper and give a rationale for C, D, and A. Put the reason why you believe A is correct. There's got to be a solid reason why you picked this. Now, sometimes you guys will get down to 2 answers and you're just like, I'm not sure. So when you hit the I'm not sure section, I want you guys to go ahead and go back and look at the question again. They've had recurrent dysuria after being treated with Bactrim for 3 days. Now, what is our priority action for this patient? Think about it. What could possibly be going on with this patient? So we know it's not A, because after 3 days of antibiotic therapy, a UTI should be successfully treated. And it says 3 days right here. So we know that there's something going on. And it says recurrent dysuria. So that should give you a clue that this patient's returning with recurrent dysuria. So in your head, you should say, okay, remind the patient about the need to drink 1,000 milliliters of fluids a day. No, they need to be drinking at least 1,800 to 2,000. So we know this is not right. So A, we're going to put an X on. So put an X on your A. B, obtain a midstream urine specimen for culture and sensitivity testing. What do we think might be going on? Yes, very good. Okay, so we're going to say B is the correct answer because we want to know, do we have the right antibiotic, right? Because maybe we don't. Maybe my infection is more sensitive to something else. So taking it for 3 more days is not going to do anything for this patient. We've already proven that, right? So we'll get rid of that one. And then suggest that the patient use Tylenol to treat the symptoms. Well, it's not going to be as effective as other medications, such as your Pyridium. So peridium is great for treating your dysuria. You just have to remember that peridium can cause orangish red urine, which can concern your patients. So please make sure that you educate them about that. But we know that this is not the best answer. So your best answer is B, obtain a midstream urine specimen for culture and sensitivity testing so we can see what the right antibiotic would be for this patient, because we know that they should have been treated. They should be symptom-free after 3 days after they've been treated for a UTI. Okay, so that's kind of how this is going to go. I hope this works for you guys. Remember, at any time you can pause it. So if you want to take more time on a question or you want to take a little more time for your ABCD, that's absolutely fine. All right. Oh, and I will leave this slide on here for you guys so that you can pause and read the rationale as well. So the nurse determines that instruction regarding prevention of future urinary tract infections for a patient with cystitis has been effective when the patient states, is it A, I can use vaginal sprays to reduce bacteria? Is it B, I will drink a quart of water or other fluids every day? Is it C, I will wash with soap and water before sexual intercourse? Or is it D, I will empty my bladder every 3 to 4 hours during the day? So you have your A, B, C, and D. I want you to go through and put question mark, check mark, or an X. And remember to look at your question. We're looking for proper instruction for prevention of UTIs. Okay. All right, so go ahead and put your answers. I'm going to give you guys just a second here. Is it A, I can use vaginal sprays to reduce bacteria? Answer is definitely no on this one. We do not want to encourage any sort of fluid sprays, lotions, creams, ointments inside the vaginal area, because it will change the pH, will then increase your risk for UTIs. I will drink a quart of water or other fluids every day. A quart of fluids is not sufficient to provide adequate urine output. So you guys already know that we need 1,800 to 2,000 milliliters of water every day. So we know B is incorrect. Drinking is correct, but the whole answer is not. So this is inaccurate. This is not accurate. I will wash with soap and water before sexual intercourse. What do we know about UTIs and sexual intercourse? We know that we need to urinate after sexual intercourse, but using soap and water before is not going to affect whether or not you get a UTI. That leaves us with D. I will empty my bladder every 3 to 4 hours during the day. This is the correct answer right here. Oops, I'm so sorry. So I will empty my bladder every 3 to 4 hours during the day. This is recommended to prevent UTIs. And that's pretty straightforward, guys. You guys want to make sure that you're emptying it every 3 to 4 hours to help clear everything out. Okay, let's go to the next. Here's your rationale. Pretty much what I've said. I've just kind of added a little bit of information for you. So number 3, which information will the nurse include when teaching the patient with a UTI about the use of peridium? All right, so we have A, take the medication for at least 7 days. B, use sunscreen while taking the peridium. C, the urine may turn a reddish-orange color. Or D, use the peridium before sexual intercourse. So you have A, B, C, and D. And you want to take a look and see what it's saying. So we're teaching a patient with a UTI about peridium. So this is patient education for peridium, right? And you can always write out what you, like in an easier terms for yourself, what the question is asking. So it's patient education, peridium. And that should help you. This is not easy, guys. I'm so sorry. That should help to remind you of what you're looking for. So this means you have to know about this medication to be able to teach your patient about it. So is it A, take the medication for at least 7 days? We're going to say for this one, the patient should take it how the doctor would prescribe it. And this is an analgesic, so it only needs to be used for a few days until the pain is no longer there. So we're going to put an X here, and then on your paper, you're going to put an X there. B, use the sunscreen while taking the Pyridium. So use the sunscreen while taking the Pyridium. Do we need to use sunscreen before taking Pyridium? It doesn't affect, it doesn't have a photosensitivity issue, so we're going to say no. Put your X here. Urine may turn a reddish-orange color. Oh, wait, this might sound familiar. I might have talked about this earlier. So I'm going to put this is definitely a potential. And use a Pyridium before sexual intercourse. Before intercourse, it doesn't help in reducing the risk for UTI. This is strictly for analgesia of the urinary tract. So we're going to say no to D like that. And then we're going to say that C is the correct answer. Yay, it's C. Okay, so for the next one, I'm going to have you guys, I'm going to read the question. I'm going to give you a second to look at the answers. I'm going to have you fill out your A, B, C, D without me. So take a few seconds, pause it. I'll tell you when to pause it. So go ahead and pause it when I tell you. Read through the answers, put your A, B, C, D without me, and then we'll go through it together. A 72-year-old who has benign BP, I'm so sorry. Okay, let's refresh. A 72-year-old who has BPH is admitted to the hospital with chills, fever, and vomiting. Which findings by the nurse will be most helpful in determining whether the patient has an upper urinary tract infection? So remember, do your A, B, C, and your D. Now go ahead and take a minute. I want you to read A and then put check mark, question mark, or an X. Okay. We have chills. Oh, okay. All right, so we're going to go ahead and go ahead and pause it if you didn't have enough time. But we're going to start with A, suprapubic pain. Actually, I'm so sorry. Let's start here. So we have BPH, and we have chills, fever, and vomiting. Chills, fever, and vomiting. What does that mean to you? Potential infection. Okay, so write infection here. Okay. Yep, that's infection. Okay. So we want to know what's most helpful to determine whether the patient has a upper UTI. Now, an upper UTI would be what? Yes, it's going to be in the kidneys, right? We're looking for kidney symptoms about kidney issues. All right, so now that we've broken down the question and gone through those answers, let's say suprapubic pain is going to be a lower UTI. Bladder distension is going to be a lower UTI. Foul-smelling urine is going to be a lower. So we know A, B, and C are all incorrect. CVA tenderness. Is this it, guys? Yes. Costovertebral tenderness is characteristic of a pyelonephritis, along with the gross hematuria. But generally, kidney pain, guys, is a huge indicator that your patient has an infection in their kidneys, which is what pyelonephritis is. So always remember that, okay? CVA tenderness, when you check it, your patient is going to be very uncomfortable when you do this exercise on them. So please be aware of that and educate them on why you're doing it, okay? All right, next one, D, and we know the other ones are all lower, okay? Next question. After teaching a patient with interstitial cystitis about management of the condition, the nurse determines that further instruction is needed when the patient says, A, I will have to stop having coffee and orange juice for breakfast. B, I should start taking a high-potency multiple vitamin every morning. C, I will buy some calcium glycerophosphate or Prelif at the pharmacy. Or D, I should call the doctor about increased bladder pain. So you want to look at what the question's asking. It says the nurse determines that further instruction is needed. So we are looking for the wrong information. What is inaccurate about this? So you guys have to know about interstitial cystitis. A, B, C, D. High potency multiple vitamins. Oh, sorry guys. Go ahead and pause it. And then when you're ready, go ahead and play it. All right, so A, I will have to stop taking, or I have to stop having coffee and orange juice for breakfast. Coffee and orange juice for breakfast is fine for this. It doesn't affect it. B, I should start taking a high potency. This is your cue right here. High potency multivitamin can actually irritate the bladder and increase symptoms of cystitis. So we definitely need to make sure that our patient is aware that this is not correct information. Calcium is fine, and increased bladder pain or odorous urine, this is definitely a sign that a patient needs to do something. So that's a correct answer. So we were looking for the incorrect answer on this one. Okay. Patient's renal calculus is analyzed as being very high in uric acid. To prevent recurrence of stones, the nurse teaches the patient to avoid eating. Now, this is not something that you guys need to know for this exam. This is just kind of a way to get you guys to just do more NCLEX questions and think about what you've read. So you might be able to answer this if you remember it from your book. Okay, so we're looking for something with high uric acid because we want to prevent kidney stones. So we want to find out what we need to avoid eating. So remember, do your A, B, C, and D. So you guys know that organ meats and sardines are high in purine, which increases your uric acid. And you guys know this because of what you guys covered for exam 2 in Med-Surg for gout. So that is how you should know this answer, actually. So spinach, chocolate, tomatoes, legumes, dried fruit will increase the incidence of your calcium-containing stones. You know this has calcium in it. You know that these have calcium in it, and spinach and chocolate and tea have calcium. So something to keep in mind when you think about your fluids and electrolytes. If your patient is intaking too much of this stuff, they might get hypercalcemia, right? Okay, so let's go to the next. There's your rationale. All right, next question. To prevent the recurrence of renal calculi, the nurse teaches the patient to A, use a filter to strain all urine. Does this sound correct to you? Put your X, check mark, or question mark. Go B, avoid dietary sources of calcium. Once again, put your answer. C, drink diuretic fluids such as coffee. Or D, have 2,000 to 3,000 of milliliters of fluid a day. Okay. So we're going to go to the question and say we are trying to prevent renal calculi. So what are we going to do to prevent kidney stones? So we're going to write that down. Prevent kidney stones. Okay? So is it A, Use a filter to strain all urine. No. Why? Correct. Very good. We don't need to filter urine. Filtering to strain all of our urine is only after we've had a kidney stone and we've had our lithotripsy, right? So we know A is definitely not correct. Avoid dietary sources of calcium. Is avoiding calcium going to prevent recurrence of renal calculi? It doesn't say calcium renal stones, it just says renal calculi, so just kidney stones in general, right? And so avoiding just calcium is not going to do that. Plus, then you guys are not getting the calcium that your body needs. Drinking a diuretic fluid such as coffee, that's actually very incorrect because that can increase your risk for kidney stones. That leaves us at having to drink 2,000 to 3,000 milliliters of fluid a day. Now, you might have seen 3,000 milliliters of fluid and you might have been like, wow, that's too much. But this is the most accurate and best way for your patient to prevent the reoccurrence of renal calculi. Remember, 2,000 is usually what we say, but 2,000 to 3,000 milliliters of fluid is going to help to flush the body of all of the stuff that it needs to keep the kidneys working well, because you have to flush out the minerals before those stones can form. So we said no to C, and then we're going to have our big check mark. Remember, our check mark, we gave a rationale. What's the rationale? We need to flush out the minerals. All right, here's your rationale. And after obtaining the health history for a 25-year-old who smokes 2 packs of cigarettes daily, the nurse will plan to do teaching about the increased risk for. So now we're looking for an answer. We want an increased risk for a problem for someone who smokes 2 packs of cigarettes a day and a 25-year-old. Okay? So what are they going to be at the highest risk for? A, B, C, D. Now, this is going to be a knowledge question. This is just a recall. Do you know, based on this information, who this, what this person is at the highest risk for? So go ahead and pause it. Go ahead and do your A, B, C, D. Okay, so we know the main issue for this patient is that they smoke a lot. Okay, 2 packs of cigs a day. All right, is that going to increase, are they going to have an increased risk for kidney stones? No. We already said that kidney stones are increased because of coffee, not enough water, dehydration, the inability to clear out flush those minerals, and increasing the substances that create the minerals. Bladder cancer. How's that one feel? You guys want to put a question mark on that one? Maybe that's the answer. How about a bladder infection, which is cystitis, by the way, if you guys weren't aware. Cystitis is a bladder infection. So is smoking going to increase the risk for bladder infection? No, there's no evidence indicating that. And then what about interstitial cystitis? No? Okay, so it's pretty much the same thing as a bladder infection, right? We have an infection in the bladder. So bladder infection, issue with bladder, we said no. But you remember from your book that it's something to do with the bladder. So we have bladder infection, which we already said was incorrect. Bladder cancer. So this is something you have to just remember. Cigarette smoking is a risk factor for bladder cancer. Now, I'm going to test you guys for an extra question here just to kind of get you guys thinking. If your patient is diagnosed with bladder cancer, what type of chemotherapy will we use on this patient? Good, intravesical chemotherapy. Very good. Where they actually put it through a catheter, so it goes straight to the bladder to kill the problem, right? Which is the cancer. All right, and here's your answer. A 78-year-old who has been admitted to the hospital with dehydration is confused and incontinent of urine. Which nursing action will be best to include in the plan of care? Is it A, Apply absorbent incontinent pads. Is it B, restrict fluids after the evening meal? Is it C, insert an indwelling catheter until the symptoms have resolved? Or is it D, assist the patient to the bathroom every 2 hours during the day? So go ahead and pause it and take a look. All right, so let's take a look at our patient here. We got A, B, C, and D. Question is asking, we have dehydration and we are confused and we're incontinent of urine. So we want the best plan of care for this patient. So do we use incontinent pads? Are we supposed to, is the best plan to use absorbent incontinent pads? No, that is not correct. Why? Skin breakdown. So we're not going to do that. Skin breakdown. So definitely not A. Is it B, restrict fluids after the evening meal? Restricting fluids is never the right answer. If they're on a fluid restriction, there has to be a good reason for it. Generally, we want to increase our fluids, right? And we said our patient is incontinent. We don't want to, you don't want to restrict your fluids, guys. Just be nice to your patients. It's not appropriate. Your patient already has dehydration, so restricting fluids is just gonna make their problem worse. It's gonna make their BUN go high. Oh, shoot. Oh. Okay, well, I accidentally hit the wrong button, so let's just move on. But so the answer is, let me go back. Where is it? Oh, your answer for this one is D, assess the patient to the bathroom every 2 hours during the day. So like we said, restricting fluids is not appropriate. Incontinent pads is going to increase the risk for UTI or skin breakdown. And then, of course, we know indwelling catheters are only appropriate for Houdini. And having a confused older patient with incontinence is not a reason to use. If your scheduling does not work, then perhaps we could, move to something else. But for now, the first thing that you need to do is put your patient on a schedule. Next question. A 62-year-old asks a nurse for a perineal pad, stating that laughing or coughing causes leakage of urine. Which intervention is most appropriate to include in the care plan? So do your ABCD again. Okay. The A, assist the patient to the bathroom, Q3 hours. B, place a commode at the patient's bedside. C, demonstrate how to perform the Crede maneuver. Or D, teach the patient how to perform Kegel exercises. Okay. The Crede maneuver is actually used to help empty the bladder for patients with overflow incontinence, so that's not appropriate for this patient. And what type of incontinence is this that this patient is having? Stress. Very good. Yes. Coughing causes leakage of urine and laughing causes leakage of urine. This is stress incontinence. So we know that this is not correct because that's for overflow. Placing the commode close to the bedside and assisting the patient to the bathroom is helpful for functional incontinence, right? So functional means that they can't get to the bed, can't get to the toilet in time to urinate. And assisting the patient to the bathroom every 3 hours would not be frequent enough. And that's not going to help this patient either. That's going to go with functional incontinence, right? Teach the patient how to perform Kegel exercises. You guys all understand that there are different ways to strengthen the pelvic floor, which can help to reduce stress incontinence. So Kegel exercises is a great way to do this. Can you think of a surgical intervention that would help with stress incontinence? If you said suburethral sling, you are correct. Very good. Urethral sling. And you can use Pessieres. Those are non-surgical, but this one is a surgical intervention. Okay, next question. Oh, here's your rationale. Following rectal surgery, a patient voids about 50 milliliters of urine every 30 to 60 minutes. Which nursing action is most appropriate? A, use an ultrasound ultrasound scanner to check the post-voiding residual. B, monitor the patient's intake and output over the next few hours. C, have the patient take small amounts of fluid frequently throughout the day. Or D, reassure the patient that this is normal after rectal surgery because of anesthesia. All right, so your patient voids about 50 milliliters of urine every 30 to 60 minutes. What do we need to make sure that our patient is doing? Yes, we need to check for residual urine, and the way that we do that is with an ultrasound scanner. Very good. Okay. So next question. A patient in the hospital has a history of functional urinary incontinence. Which nursing action will be included in the plan of care? A, place a bedside commode near the patient's bed. B, demonstrate the use of the Crede maneuver to the patient. C, use an ultrasound scanner to check post-voiding residuals. Or D, teach the use of Kegel exercises to strengthen the pelvic floor. Does this sound familiar, guys? All right. You are correct. It is A. Modifications to the environment make it easier to avoid functional incontinence. We know that the Crede maneuver is used for overflow incontinence. Kegel is for urge, or Kegel is for stress. I'm sorry. Kegel exercises are used for stress incontinence. And residual urine is also something that we would check for somebody who has overflow incontinence, because it means that they're not emptying their bladder all of the way and they constantly feel like they have to. Next, there we go. Patient with bladder cancer is scheduled for intravesical chemotherapy. In preparation for the treatment, the nurse will teach the patient about. So now the question is asking you what you need to educate your patient about for bladder cancer, treatment for bladder cancer. Now we're about to stick a catheter, intravesical chemotherapy, into your patient, and we want to be able to put this chemotherapy into the patient's bladder. So are they going to get nauseous? No. No, this is not going to happen. They're not going to lose, they're not going to have any systemic effects during this. So all of these are incorrect. If you look, these are all systemic effects, and these are all three answers are systemic. This one is simply, we need to make sure we empty the bladder before treatment. Okay, so even if you don't know this information, you can look at your options here and say, these two things are very similar. We know we get nauseous, oral care, nausea, losing hair, these are all systemic side effects. So if you understand that intravesical chemo does not cause systemic side effects because it's just in the bladder, you can guess that D is the correct. Another question. When assessing a patient who has a lower UTI, the nurse will initially ask about, is it A, nausea, B, flank pain, C, poor urine output, or D, pain with urination? So I want you guys to think about this question. I know what you want to say, but let's look at this. We're talking about a UTI, lower UTI, so regular UTI, right? Lower UTI. And the nurse is going to ask initially about what? Now, what are your normal symptoms of a UTI? So poor urine output is difficulty or dysuria, right? And same with pain with urination. Actually, hang on, scratch that. Instead of looking at it as poor urine output, that would be lower urine output. They usually have an increase, so they'll have frequency, not poor, right? Frequency, goodness, frequency and urgency, right, are signs and symptoms of a UTI. So then we have flank pain, which is going to be pyelo, right? This is a symptom of pyelonephritis. Nausea, that's going to be a symptom of pyelonephritis. So pain with urination is going to be a common symptom for a lower UTI. So this is simply asking, what are the symptoms of a lower UTI? Because if they have pain with urination, we can definitely say that it is a UTI. If your patient's complaining of nausea and flank pain, then you can ask, okay, well, maybe we need to do a step further. What labs would you guys draw? Do they have inflammation with infection usually? Okay, so let's look at that ESR, that CRP. Those are both going to increase, right? Are the white blood cells going to increase with the pyelo? If it's an infection, absolutely. Yes. Are they going to have a temperature? Yes. If it's an infection, yes, they will. So just start to think about those things as you guys start moving through these courses, because when you guys get into 7th semester, you guys are going to start looking at a lot more about like complications of diseases and how you guys prevent those complications. Okay, so there's your answer. D, flank pain and nausea are associated with an upper. Urine output does not decrease, but frequency may be experienced. And then pain with urination is a common symptom of a lower UTI. Here's another question. Which assessment finding for a patient who has just been admitted with acute pyelonephritis is most important for the nurse to report to the healthcare provider? So I want you guys to think, I know we're not really talking about pyelo, but once again, you guys should be able to look at these options and determine if this is the right answer, well, what the right answer is. So let's look at this question together. Which assessment finding who's just been admitted for acute pyelo is most important to tell the doctor? So that means we're looking for the unexpected, right guys? Unexpected. So when you look at this question, you need to ask yourself, is this expected or unexpected? All right, foul-smelling urine. Well, a UTI can cause a pyelo, right? Pyelo is just an upper UTI if you look at some of what the books say. So upper UTI, pyelonephritis, your kidneys. So the UTI has traveled to the kidneys. So this is expected. Complaint of flank pain. We already said flank pain was a finding for pyelo. So this is expected. Didn't I just say that a temperature is expected? Yes. So we know that a low blood pressure is not expected, and it actually will indicate that your patient is in shock or sepsis, okay? So just something to think about as you guys. So we have an 88-year-old with, another question. 88-year-old with BPH has a markedly distended bladder and is agitated and confused. Which of the following interventions prescribed by the healthcare provider should the nurse implement first? BPH, distended bladder, agitated and confused. Ooh, and look, he's 88, so he's old. He has a distended bladder, so we know that it's full, right? It's full. Okay. And he's agitated and confused. What do you guys think is going on? Think about what BPH does. Does BPH allow you to urinate fully? No. They have frequency, they have urgency, they have nocturia, they always have a feeling of fullness. So are we going to insert a urinary catheter? No, this is not correct at this time, right? Do we need to do an intravenous pyelogram? No, this is not necessary at this time. Oh, I'm sorry. Okay, scratch that. You guys are probably like, what is she saying? That's wrong. No, if our patient has a distended bladder, they're agitated and confused, we know that our patient has urinary retention, and we know that urinary retention is something that your patients can have with BPH. So I'm sorry, this is the correct answer. Ativan is not appropriate for this patient right now. Once the bladder is corrected, drugs they can be used cautiously in our older patients, but we really don't need to give that to him because he's just confused and agitated because he's retaining his urine. Getting a BUN and creatinine can be obtained after we fix the problem. So this is important, but this one is the most important thing to do for this patient because we need to get that urine out. Oh, sorry guys, these are a lot of questions. We're almost done. Hang in. Okay, another question. A patient with renal calculi is hospitalized with gross hematuria and severe colicky left flank pain. Which nursing action will be of highest priority at this time? Okay, so you should know that the signs and symptoms: severe colicky left flank pain, renal calculi, gross hematuria. We want the highest priority for this patient. If I have renal calculi, am I in pain? The answer is yes. 10 out of 10 pain. This is a very, very uncomfortable disease process. If your patient has urolithiasis or renal stones, kidney stones, do we need to do this? Yes, absolutely. Do we need to monitor their temperature? Yes, because what can it turn into? Pyelonephritis. Very good. Will they have nausea and may we need to give them an antiemetic? Yes, but there's no signs of any of these things right now. So the best thing to do is give this patient pain meds. When the nurse is caring for a patient who has had left-sided extracorporeal shockwave lithotripsy, which assessment finding is most important to report to the healthcare provider? This is a good question, guys. Okay, so what are we expecting to happen when we use lithotripsy? Okay, lithotripsy, we want to report to the healthcare provider. So this is an expected versus unexpected, right? What are your expected findings after your patients have lithotripsy? They're gonna break your stones, the stone into like small little sand pieces. And what happens is that can block that ureter, right? We already know that the stone is, but we're expecting some pain, right? Because this isn't just over. There could be bruising and blood in the urine. These are all expected side effects. A drop in urine output means that we have blocked the ureter again, okay? All right, guys, you got through it. This is about 43 minutes, 44 minutes. I hope this helps you guys to kind of look at the questions a little differently and kind of just test your knowledge and ability to answer NCLEX questions on this content. If you guys have any questions about it, please make sure that you reach out to your teachers and always refer back to ATI and FA Davis. Good luck on exam 4, and I hope you guys have a good weekend. Thanks.